Levels of prevention. Levels of prevention is divided into four: primordial, primary, secondary, tertiary. In primordial, prevention of emergence or development of risk factors. So here what we are doing is we are trying to prevent the occurrence of risk factors. Thus, we are trying to prevent the disease. Okay, here we are trying to prevent the risk factors. Emergence of risk factors we are preventing. So that's why primordial prevention. Okay, here we are doing health education, health promotion activities, etc. In primary prevention, prevention of disease when risk factor is present. Here there is risk factor for the patient. For example, if the patient is have the habit of smoking or have the habit of drinking alcohol, the patient is more risk to more prone to get some disease like lung cancer, or in case of alcoholism there may be chance for liver disease, etc. So risk for disease is present here. We are trying to prevent that disease. That is primary prevention. In primary prevention, prevention of disease when risk factor is present. So what we are doing, we are, in order to prevent the disease, we are lifestyle modification we are advising. So in that we will say that avoid alcohol, avoid smoking, etc. So that is primary prevention. In secondary prevention, prevention of complication of disease from occurring. So here early diagnosis, prompt, optimized and sustained care. In secondary prevention, actually the patient have signs and symptoms of disease, and if we identify, for example, if the patient have breast cancer, if we identified in early, that will help to prevent the complication of the disease. So that is secondary prevention, prevention of complication of disease from occurring. So that will help by that will done by early diagnosis and prompt treatment. That is secondary prevention. In tertiary prevention, prevention of disability or death, that is rehabilitation, disability prevention, etc. So here what we are doing is, for example, if the patient have diabetes have lot of complication like microvascular complication, macrovascular complication, diabetic foot, etc. So if the patient have diabetic foot, we need sometimes we need to amputate the toes, right? So we have to avoid that, or in order to, or sometimes if it is very severe, we have to remove the leg. So that leads to disability, right? So that is known as the prevention of disability or death to the patient. Or in case of stroke, if we treat the patient in case of ischemic stroke, if we are treating the patient early, there will not be any complications such as hemiparalysis, etc. So that we can prevent here. In tertiary prevention, we are giving importance to prevent the disability or death, thus improving the quality of the life of the patient. So the mode of intervention is rehabilitation and disability prevention. So that is regarding the levels of prevention. Levels of prevention is divided into four: primordial, primary, secondary and tertiary. Primordial, before the occurrence of risk factors. Primary, before the occurrence of disease. Secondary, before the occurrence of complication. Tertiary, in order to improve the quality of life, in order to prevent the disability or death. Okay, thank you.